Welcome back. During the month of October, Chris 6 News anchor Jennifer Lita is bringing you a series of reports on breast cancer. It's the most common form of cancer in women, and tonight our series starts with a hard look at breast cancer. What is it? Who can get it? And is there any way to avoid it?
Just about any woman can get breast cancer.
They're hard words to hear, but the reality is 1 in 8 women will get breast cancer. Nearly 252,000 American women will be newly diagnosed this year. More than 40,000 of them won't survive. But what is breast cancer, and is there any way to avoid it? For those answers, we spoke with Dr. Edwin Watts. He's a radiation oncologist with Christus Spohn.
Breast cancer is a very unique disease in that it's actually an abnormal growth of cells that can be deadly that starts within the breast tissues itself.
There are many different forms of breast cancer, some hormone-driven, others the result of gene mutations. But if you think it's a disease that only affects women, think again.
I myself have treated at least 10 males with breast cancer.
According to the American Cancer Society, nearly 2,500 men this year will find out they have breast cancer. 400 men will die from it.
One of the things you want to realize is that those fat cells can feed any abnormal growth going on in any breast tissue, male or female.
Part of your risk comes from things that you can't control. Your race. Studies show that African American women are at higher risk. Your genetics. If someone in your immediate family has breast cancer, your chances can go up by as much as 50%. Also, your age plays a role, especially in reoccurrence.
So it actually shows statistically that the younger you are, the more likely you are to have it come back in your lifetime.
What's important to remember is treatment today is better than ever before. Dr. Watts says the easiest way to lower your risk is get healthy, get fit, lose weight, eat better, limit your alcohol intake, and most importantly, do self-exams and get those yearly mammograms.
So with listening to your physicians and doing the appropriate testing and doing the appropriate therapies that are recommended, you actually have really good chances in breast cancer nowadays, even the more advanced ones.
Jennifer Lita, Chris 6 News.
Next week, Jen is looking into mammograms and what to expect if you've never had one. She'll also tell you about new 3D imaging that's catching smaller cancers earlier than ever before.